Greetings, darlings. This is Annette of AnnetteLeonard.com, back again with Chronic Wellness. I'm going to talk today about thrush. What is it? Who gets it? How do you get it? What's it all about? I have a lot of experience with this topic, and so I'm going to spend a few minutes expanding. And may you never know. May you never have experience with thrush. I remember first hearing about thrush like peripherally in the late 80s, early 90s. I'm dating myself, and that's a-okay because thrush was discussed in relation to AIDS patients. And the reason thrush was talked about in relation to AIDS patients is because AIDS patients had severely suppressed immune systems. So that's the key. People who have really limited immune systems are folks who usually get thrush. So that list includes babies. They don't yet have their immune systems developed. And really fairly old people who have limited immune systems. And then people like me who are having their immune systems artificially suppressed. So, folks on chemotherapy, cancer patients, people with autoimmune diseases whose immune systems we are suppressing. And for me, that's chemotherapy. And so, what is thrush? Thrush is an overgrowth of candida. Candida is yeast. So, this is a yeast infection of the mouth, which I can acknowledge sounds epically disgusting. And it's not as gross as that might lead you to think it is. It's not like you're baking loaves of bread in your mouth. It's not that kind of yeast. Yeast is present on our skin, in our mouths, in our intestine, in our stools at all times. And thrush is an overgrowth of that yeast that is always there and oftentimes gets a chance to overgrow when things are out of balance. So, in the case of my recent thrush, that happened because I was put on antibiotics. So, I already have this suppressed immune system, a tendency to have more yeast in my system. And then we add in an antibiotic, which kills off bacteria. And bacteria is part of what keeps the yeast in balance. And then the yeast having a chance to overgrow. And when they overgrow, the first symptom for me is like a coating, kind of a film on my tongue. And for me, I start craving either and sweets or creamy things like yogurt, ice cream. So that's usually also sweet, right? So sweets and cold creamy things is what I immediately start craving. And then I start craving like acidic or carbonated things that seem like they would start to kind of work away at, deteriorate, or erode that film that has formed on my tongue. As thrush progresses, it can cause this very noticeable white growth, white presentation on your tongue, sometimes on your tonsils, the back of your throat, and if it gets really bad, inside the cheeks of your mouth. And then, really, the only remedy is to start to treat it pharmacologically. So at that point, you contact your doctor, and the way that the doctor treats it is either with lozenges and or with mouth rinse. And you use those, like those sit in your mouth. So you hold the rinse ideally for a minute or two, or you suck on the lozenge and that takes a while to dissolve. You do that usually 4 times a day. And those start to eat away at the yeast that's in your mouth and start to then limit it, start to bring stasis back. And you do that for 10 to 14 days. So this is not something you get over quickly. It's not something that ends fast. It's not something that like you can turn it around. And for someone like me whose immune system is really out of whack, oftentimes it will take a couple of treatments for me. So like a month for me to get it fully in check. And if those oral treatments don't fully work on their own, you can, of course, move to something like an oral pill of fluconazole that just bombs your whole system. Like it's a systemic treatment that is pretty hard on your kidneys and liver. So it's not like the first thing that your doctors will typically go to treat candida systemically and try to then rein in what's happening with the yeast. It's unpleasant. It can range from mild, sort of filmy and frustrating to really aggravatingly painful. The worst thrush that I've experienced can feel in the middle of my tongue, kind of like my tongue is being cracked. And if you've ever had a painfully inflamed taste bud, you know, where you've just had one or two taste buds that are irritated and inflamed, imagine your whole tongue feeling that way, just raw, and as though someone has like taken sandpaper to your tongue. That is the sensation that accompanies thrush. So it becomes very hard to eat. It's painful. It's difficult to find foods that aren't aggravating to that oral yeast infection when it gets that bad. And my next post will be about what kinds of things I recommend you eating at the time of a yeast infection of thrush. Additionally, just one more thing I will highlight is if you have had a outbreak of thrush, if your toothbrush stays wet because you're brushing a few times a day, it's good at the end of an outbreak of thrush to think about just throwing away your toothbrush and cycling in a new one so that you're not keeping those yeast alive and keeping them on your toothbrush. Generally, people wonder if thrush can be contagious, and the question is, I mean, we all have these yeast in our mouth, and it's not typical for a healthy person to have a bloom or an overgrowth of them. But if you were to swap saliva with someone whose immune system was also compromised, they might get a bloom or an overgrowth, but it's not typical. So can you make out with your partner while you have thrush? Yeah, but you probably wouldn't want to, and they probably wouldn't want to. So possible to transmit thrush, not likely, and not likely that you'd want to, really kiss a lot with tongue while you are infected with thrush. So if you have questions about thrush, if you have experience with thrush, I'm here. I want to hear from you. So leave me a comment, ask me any questions, sound off. As ever, I am really grateful for the participation that I have from you, and always glad to share a few minutes here together. So thanks for being here, and until we're together again, be well.